And thanks so much to all the presenters in the breakout rooms. It's always really nice to have these smaller rooms where people can connect and interact, and it's a bit more casual manner. In my session, we had a really good cross section of backgrounds and skill sets, which is nice to see. It's always great to see an epidemiologist jump in there and yeah, talk about different levels of expertise that we need in order to address climate change and mental health. And it really will take a holistic, all teams approach to address everything in a meaningful manner. Growing on that is our next presentation series, which is on public health systems and community approaches to climate well-being. And our first presentation is by Christy Rosa and Christian Thompson, and they will be presenting on Transformational Resilience Coordinating Networks, a community level approach. So I'll turn it over to you now. Thanks very much.
Awesome. Thank you, Alexis. Let's see how this goes. Awesome. So first, I just want to say thank you so much for the breakout room sessions. It's always hard to follow up to something like that. So thank you so much. So just quick introductions. My name is Christy Rosa, he, she, her pronouns, and I'm from Portland State University, Ph.D. candidate at the School of Social Work there. I work with Christian specifically at Trauma Informed Oregon, which is a program within the School of Social Work. And I also want to add that Portland State University stands today on the historic homelands of several bands of Chinook-speaking people, including many Multnomah, Clackamas, Swalala, and Cascade villages. And I myself am on Vancouver, Washington, which is also home of Cowlitz lands as well. And Christian, do you want to introduce yourself?
Hey, thanks for getting us started, Christy. Hey, I'm Christian, folks. Yeah, finished up my MSW program here at Portland State last year and have been having a really great time partnering with Christy around this work. So it's great to see everybody today and excited to be here.
Awesome. Thanks, Christian. So let's do just a quick overview of who we are and what we're going to be talking about today. So Trauma Informed Oregon is part of the steering committee and a long-term partner of the Transformational Resilience Coalition, the International Transformational Resilience Coalition, or ITRC. You're going to find there's a lot of acronyms in this presentation today, and I'm going to try to say them all out loud because it can be quite a lot. And ITRC was founded by our dear friend and mentor, Bob Doppelt, who is now retired, but one of those retired but not so retired faculty members from University of Oregon, who has a background in counseling, psychology, and as an environmental scientist. So ITRC is made up of multiple organizations and co-sponsors all around the world, and really focusing on the role of transformational resilience in responding to the climate crisis. And today we're going to specifically talk about an initiative that ITRC launched in 2024 to help organize, strengthen community-led action, which Christian is going to talk more about. This partnership was this initiative is part of the United Nations High-Level Climate Champion Race to Resilience campaign, which aims to drive climate resilience across the world through community-led action. So a quick little bit of background. Hold on, I gotta make you small because it's taking over my space. So a little bit of background. I don't think I need to speak so much to this topic just by the nature of this summit. But as many of you are familiar with, we are in a climate ecosystem biodiversity, or CEB, crisis. And at ITRC, we try to expand just saying climate crisis to CEB, just in recognition of how all the many ways in which the climate crisis is intersecting with and causing cascading disruptions to our ecological, social, and economic systems. And what we're specifically honing on is that all these systems are interconnected, and we as communities are really dependent on them, not just for, the basics, food, water, shelter, but ways of living, joy, connection, and safety. And what we're seeing now, especially with the fires in California, the flooding in Australia, and so many other CEB crises, is that we're seeing and witnessing severe stress or traumatization across populations, regardless of geographic location, regardless of wealth, privilege, and in different ways and in different magnitudes, and especially as well disproportionately impacting people with marginalized or disadvantaged or made vulnerable identities. So we're going to talk a little bit about our approach and our initiative with the Campaign for Race Resilience. And we are really seeking to move into a public health and community-led approach. And this is in part because oftentimes what we've been seeing in disaster response is there tends, at least in the United States, there tends to be a deferral to psychological first aid and referring people to mental health services. And as someone with a background in behavioral health and community crisis work, people tend to come to us only after symptoms of trauma or stress or mental health have emerged. And generally, our mental health systems are really tailored to focusing on individuals and rather the communities and working on. So we're really poorly equipped to think about how we can respond to mental health challenges related to the CEB crisis on a community level and a societal level scale. And so our approach is recognizing the need for a public health approach to mental wellness and transformational resilience within our communities. This means that we're thinking about mobilizing people locally and creating solutions and conversations and mutual aid that are locally based and locally tailored. And this also means not just bringing together people who have been harmed, but also mobilizing residents groups, organizations, all together to enhance and address all the different ways we're seeing the CEB crisis have that cascading effect on our systems. And I'm going to turn it over to Christian, who's going to give a bit more concrete detail of what that might look like.
Hey, thanks, Christy. Alrighty, so to this end, the ITRC rolled out the Transformational Resilience Coordinating Network Program or initiative. And jumping into that, what is a TRCN? So these organizations are diverse coalitions of local grassroots organizations, neighborhood groups, educators, bringing in youth, faith leaders, mental and physical health practitioners, including social workers, disaster management personnel, climate environmental workers, and really those involved in social environmental justice and any other civic, nonprofit, private, public sector leaders, cross-sector, bringing in people from all over the community, given the very much population level impact of the CEB crisis. So to this end, TRCNs from the bottom up seek to develop and implement locally appropriate strategies that help all adults, adolescents, and young children remain socially, psychologically, emotionally, behaviorally healthy and resilient during the continually climate-based adversities that we're facing. And in addition to this, seeking to engage in activities that help reduce the impact of the CEB crisis to manageable levels and enhance local conditions in the region that the TRCN is operating in. So to this end, the TRCN Commissioning Initiative helps community leaders worldwide learn how to organize a TRCN, facilitate and strengthen its operations, and develop and continually improve these strategies that use a public health approach to build population-level mental wellness and transformational resilience. So in terms of how we actually do this, oh, thank you, Christy. Yeah, so the ITRC developed this model. It's 3 tiers. Now, organizations that are seeking to get the TRCN process started will come in as prospective TRCNs. And the main objective in this stage is to develop a steering committee or a board or task force or whatever would be a locally appropriate way of noting this collection of leaders that come together to develop a clear mission, vision, and goals. And during this stage, they receive technical support from the ITRC. They receive a handbook, other written materials, videos, as well as engaging in an ongoing community of practice series that invites folks that are prospective TRCNs or really TRCNs at any stage of the process to come together, share resources, strategies, and build community around this. So after the steering committee's been developed, TRCNs then transition to an emerging TRCN. So at this stage, the TRCN seeks to begin to develop the actual strategies that they'll use to engage in a population level resilience building effort. So to this end, they are continuing to receive support from the ITRC through written materials, continuing to engage in that community of practice, and really ramping up their partnership with both the ITRC and its partners, as well as other emerging and prospective TRCNs. And after these strategies have been developed and are ready to be implemented, we arrive at the commissioned TRCN stage. So at this point, these strategies are being implemented in the community. The commissioned TRCNs continue to engage in the community of practice sessions hosted by the ITRC. But at this point, they are kind of coming alongside other organizations that are coming up through the commissioning program and sharing the strategies that are working for them and maybe what's not working, and provide some support in that way. So some examples of TRCNs in action, we are very excited to have launched our pilot cohort. And we have, as of this morning, 14 prospective TRCNs have been launched. And you can see here several continents represented. We have folks in Africa, in Europe, in Asia, and then across the United States, with many more attending info sessions, generating some interest around joining this TRCN network. So it's very exciting to see the regional diversity represented within this effort so far. And additionally, we also have one emerging TRCN that's been established. So they already have their steering committee and they're beginning to develop locally appropriate strategies here. And that's our friends at the Community Resilience Initiative out in Walla Walla, Washington, here in the Pacific Northwest of the US. So it's incredible to see all of this action going on. Excellent. All right, so we invite you all to visit the TRCN webpage that's hosted by CTIP, one of our partners, along with the ITRC, to learn more about this initiative. There's a lot that goes into this. So on the CTIP website, you'll find the handbooks associated with each stage of the commissioning program, along with videos, additional written materials, and a Google form if you're interested in signing up for a newsletter, interested in learning more, or would like to attend one of our info sessions. It'd be great to see everybody there. So that QR code on the screen will take you to the CTIP website. And along with that, we have our contact information on there too. So that top email address will be the ITRC's general inbox, and then you'll find Christy and I's information along there as well.
Thank you, Christian. And I will just do a quick spotlight of, we want to thank the people who are supporting us. It's just Christian and I representing today, but we do have a number of wonderful organizations who are part of this joint effort. So giving them love and kudos. And I think we made it right on time, Christian. That was amazing time efficiency.
Yeah, I see one question in the chat here. Okay, so this participant has written, struggling to get the question right. Referring to the earlier graph and pyramid, how can we support chronic health conditions that have oh, I believe this is for an earlier, this is a legacy question. Apologies there. Okay, so are there any other questions here? Well, thanks very much for your presentation. Yeah, and I'm wondering if you could talk, you have a big team there with lots of sites, and I'm wondering if you can speak to like, this is a really practical question, but speak about logistics. So how are you doing your monitoring and evaluation and all these different sites, and how big is your team? If you could just speak to that a little bit.
Yeah, thank you, Alexis. So we're at definitely at a pilot stage, I will say. And I'll say that we were developing this model for quite some time and running a series of like maybe 10 session community of practices. And then we suddenly were excited and honored to be part of the United Nations Climate Champion Race to Resilience campaign. And that motivated a launch in fall of last year. So it hasn't been terribly long at this point. But right now, in terms of the practicalities, people tend to join our info sessions to learn a little bit more about this approach and model. At that point, people um, join our current community of practice, which meets once a month, along with some optional like office hour style, like more info learning exchange moments. Um, at the different levels that they are in. So naturally, majority of folks are at that prospective level, where we're just giving space and time for people to come together and think about what common goals, problems, and solutions, and giving people support and as well as strength, especially in our current political climate, to reach out to neighbors, colleagues, to develop an elevator pitch, to even just talk about mental health and the CEB crisis. So myself and Christian from Transformational, Oregon, we will be beginning an evaluation once we feel that our pilot cohort feels a little bit more settled, centering a combination of the lived experience of participating in the community of practice, the common challenges and barriers to forming community-led work. This will be very much in line with research around mutual aid and grassroots initiatives. And as well as like the practical dynamics. Some groups we have found want to be very much volunteer led and don't want to be associated with certain funding that might come with restrictions. And others have found very much like they want a fiscal host, but with some fiscal sovereignty with that. So looking at the different opportunities and challenges related to just forming these TRCNs at this stage. And Christian, anything else you want to add to that?
Thank you so much, Christy. We've gotten some questions in the chat, so it's great to interact with people there and passing along some of our contact information as well. So thank you all.
Yeah, and there is a question in the chat. Are there TRCNs in British Columbia, Canada? If so, can you tell me where and any contact info? So it looks like there's a lot of excitement about your programs.
So we do have, where is it, Christian? There is somebody in Canada, not part of our prospective TRCN. But if you could put do you remember who they are, Christian?
Yeah, that's based in Edmonton, Canada.
Yeah, Edmonton. But if you put your contact information in, we could try to connect y'all if you are close to Edmonton.
Great. Thanks very much. And it's so exciting to see these coming together. I really look forward to seeing how this project develops over the next few years. It's very exciting. Thanks, everybody.
Awesome. Thanks for having us, Alexis.
Thank you all.